Hello everyone, this is Dr. The first keyword for today's presentation is horizontal apical incision, so-called Dr. Om's incision procedure in Korea, which is very effective and operative in anterior aesthetic region that was introduced at YouTube lecture number 11, socket preservation cases. This incision is a modification of vertical releasing incision to get primary closure in anterior aesthetic region for minimizing corruption of gingival texture during operation. The right-hand picture shows the scar generated from this incision after 2 years. That makes the border between the attached gingiva and the mucosal area, and it results in a sound marginal gingiva texture. Advantages of this incision are: first, to keep the interdental gingiva in anterior aesthetic region. Second, to get the releasing effect to close the wound primarily by undermining up to marginal gingiva. Third, to prevent abnormal vertical muscle forces on attached gingiva. Finally, to minimize post-operative swelling and pain. Let's go through this procedure on the other patient who has a broken incisor 1 week ago. The treatment plan was doing extraction of the tooth, implant placement, bone graft, and the provisional processes. All treatment were conducting simultaneously at one visit. First step was extracting the root carefully to avoid trauma on labial cortical bone and interdental gingiva for aesthetic reasons. During extraction and curette, palpate the labial cortical bones to prevent inadvertent trauma, and then excise the gingival margins to make it as a fresh wound. And the narrow implant was placed. The dentin particle was prepared as a sticky and moldable form, adding 2 or 3 droplets of salines into the moldable auto-BT dentin powders. Do stirring and dabbing vigorously until it becomes sticky enough to make it round ball shape with your fingers. It's very easy. And horizontal incisions up to periosteum was made in apex and undermine tunnel to the marginal gingiva instead of vertical releasing incisions for the purpose of releasing for primary closure as well as protecting attached gingiva in aesthetic regions. Moldable auto-BT dentin powder was transferred and packed into the sockets under light finger pressure and with instrument. As you can see, it's not moving with patient own blood, and it's very easy to handle. After filling the dentin powder, put the prosthetic abutment. Suture and confirm the marginal gingiva was adapted to the prosthetic abutment closely. After that, deliver the provisional crown and leave the apical horizontal incisions without sutures. Just gauze biting for 2 hours is enough for post-operative care. In brief summary, palpate and protect the labial bone during extraction, curette, and implant placement in order to keep the aesthetic contour. Prepared, transferred sticky moldable auto-VT and packed it into a socket. In consideration of 80-year-old female patient who has a broken upper right central incisor 1 week ago, it would be necessary to use strong osteoinductive moldable auto-VT dentin powders reinforced with bone morphogenic protein, and put prosthetic abutment and suture along with Dr. incision, which was left without sutures. See the healing progress of the incision area. It was almost healed naturally within 2 weeks. With the time changes, there has been no complications of bleeding, swelling, pain, and etc. It was very natural. Post-operative CBCT shows remained labial socket wall and repaired area with dentin powder reinforced with bone morphogenic protein. The observation of the area where the dentin particles were placed will be monitored and reported clinically thereafter. Here we have another case of the healing result by time in 16 months. Observation. After Dr. surgical procedure on, the patient had labial defect filled with zinc oxide paste between the root, eroded and processes for more than 2 years. As a result, labial marginal gingivitis persists. The treatment plan was same as the previous case. Extract the root to minimize trauma on labial cortical bone and marginal gingiva for aesthetic reason. Place the implant with socket preservation using dentin powders reinforced with bone morphogenic protein. Put prosthetic abutment for provisional processes. Apical horizontal incisions on the sound labial cortical bone and tunnels to marginal gingiva for releasing purposes. Sutured 1 month later, well-healed incision area with secondary intention, and 6 months later see the gingival texture and labial contour with final processes. It looks very natural. The left is the immediate post-op CBCT image, which shows repaired area over labial cortical bone margins. The center shows repaired labial bone from cortical margins to implant neck area after 16 months. In 3D image, the area of repaired bone from remained labial cortical bone margins to the implant neck area is more evidently observed. The difference between the repaired bone and the remained cortical bone is less developed cancerous bone below cortical bone. Here we have home messages. This incision, so-called Dr. incision, is convenient for primary closure of socket without damages on anterior aesthetics, as well as prevention of swelling and pain in post-operative period. In addition, horizontal scar formed at the later stage protect inadvertent vertical muscle forces on the anterior gingiva and has deepening effect of shallow vestibule. The use of moldable auto-VT dentin powder reinforced with bone morphogenic protein is strongly recommended if there is not enough sound bone healing capacities such as inflammation, infection, medically compromised wound, as well as old age and etc. The product solution of moldable auto-VT dentin powder with reinforced with bone morphogenic protein has strong osteoinductive capabilities. Thank you for your kind attention. This has been Dr.